go for the branches. From the first branch, is it visible from that area? This artery which is running medial, this is the superior thoracic artery, superior thoracic artery. Okay, from the first part, one branch. From the second part, we had two arteries. This is the thoracoacromial artery, this is the lateral thoracic artery. Thoracoacromial artery and the lateral thoracic artery. The thoracoacromial artery immediately divides into four branches. Okay, a deltoid branch running downwards, a acromion branch going toward the acromion process, a pectoral branch run between the pectoralis major and minor, a clavicular branch going medially for the subclavius muscle and sternoclavicular joint. Done? So that is the thoracoacromial artery. This is the lateral thoracic artery which runs along the lateral lower border of the pectoralis minor. It will be bigger in female to supply the lateral part of the mammary gland. Lateral part of the mammary gland as the lateral mammary branches. Okay? Coming to the third part. This is the biggest branch of the axillary artery, which is called as the subscapular artery. This is the subscapular artery, visible?
Yeah.
Subscapular artery, okay, which runs along the lower border of the subscapularis, where it get the company of the nerve to latissimus dorsi. Okay, on the way it give a big branch which winds around the lateral border of the scapula within the origin of the teres minor. This branch is called as the circumflex scapular artery. Circumflex scapular artery. Okay, this is subscapular artery, this is circumflex scapular artery. After giving off this branch, the terminal part of the subscapular artery is called thoracodorsal artery. So, the nerve to latissimus dorsi, also otherwise called as the thoracodorsal nerve. No, thoracodorsal nerve. Done?
Yes.
Here. In this body, as a variation, you can see a branch from the subscapular artery. You can see one artery is going deep into the quadrangular space. This is the axillary nerve. This is the axillary nerve. You can see the axillary nerve is dipping into this space. This space is called as quadrangular space. Into it, along with the axillary nerve, this artery also goes. This is the posterior circumflex humeral artery. Posterior circumflex humeral artery. Okay? So that is the bigger branch of the compared to anterior branch. The anterior branch, usually the both anterior and posterior, anterior and posterior circumflex artery arises independently from the third part of the axillary artery. Okay, the anterior branch is tinier one which go underneath the coracobrachialis, winds around the surgical neck of the humerus and anastomoses with the posterior circumflex artery, which is passing through the quadrangular space. Here, as a variation, both are coming from the as a branch of subscapular artery in this cadaver. Understood? Can you see one goes upward? This is the anterior. This one. Broken one. Okay. So these are the 6 branches of the axillary artery. So the branches of the axillary artery. The first branch give 1 branch, second branch give 2 branches, and third branch give 3 branches. So you can see one single artery running downwards here. This artery is the superior thoracic artery. Superior thoracic artery.
So it runs downwards between the pectoralis major and pectoralis minor, and anastom supply these muscles and get anastomosis with the and branches of the internal thoracic artery. It's a small branch actually. So the branches from the second part. You are seeing this is the first branch called as the superior thoracic artery. One, you are seeing two branches emerging from the on either side of the pectoralis minor. These are the branches of the second part. One is going upward, one is going downwards. So the one going upward is the thoracoacromial artery. The one which is running downwards is the lateral thoracic artery. Okay. So this is the branch coming from the first part called as superior thoracic artery. These two are the branches coming from the second part. The one which is running upward and piercing the clavipectoral fascia is the thoracoacromial artery. It's a small trunk but wider one, immediately divides into four branches. The pectoral branch, acromial branch, deltoid branch and clavicular branch. Okay. So the pectoral branch run between the pectoralis major and minor muscle and supply that area. Acromial branch run backward to the acromion process and take part in the anastomosis around the acromion process. The deltoid branch runs along with the deltoid, the cephalic vein. This is the cephalic vein, runs along with the cephalic vein in the deltopectoral groove and supply the pectoralis major and the deltoid together. The clavicular branch run medially to supply the subclavius muscle and the sternoclavicular joint. Done. Lateral thoracic artery. The lateral thoracic artery runs along the lower border of the pectoralis minor. These arteries are bigger in females to supply the lateral part of the mammary gland. So it is called as the lateral mammary branches. Lateral mammary branches are the branches of the lateral thoracic artery. The medial part of the breast is supplied similarly by the medial mammary branches, which are derived from the internal thoracic artery. Subscapular artery. So this is your lateral. So here this is the subscapular artery. This is lateral thoracic artery. This is subscapular artery, the biggest of all. The biggest of the branch, the biggest among the branches of the axillary artery. Okay. So it runs along the lower border of the subscapularis. This is the subscapularis. Runs along the lower border of subscapularis to reach the inferior angle of the scapula. It takes part in the anastomosis around the scapula. On its way, can you see a branch running here? This branch of the subscapular artery is called as circumflex scapular artery. Circumflex scapular artery, which pierces the fibers of the teres minor muscle and enters into the infraspinous fossa of the scapula and takes part in the formation of the anastomosis around the scapula. Okay, circumflex scapular artery take part in the anastomosis of the anastomosis around the scapula. About this, we will discuss later what is the anastomosis around the scapula, what is its insignificance. So, along with the subscapular artery, can you see one nerve is running down? This is a thick friend of this artery. The nerve which is running downwards along with the subscapular artery. This nerve is called as the nerve to latissimus dorsi. This is the latissimus dorsi muscle. Can you see the nerve entering into it? This nerve which is running along with the subscapular artery is called as thoracodorsal nerve, otherwise called nerve to latissimus dorsi. Nerve to latissimus dorsi. Okay. So the part of the subscapular artery after giving off the circumflex scapular artery is called thoracodorsal artery. So this is called as thoracodorsal artery, which accompany the thoracodorsal nerve, otherwise called as nerve to latissimus dorsi. So this is the this is the subscapular artery. Superior thoracic artery, thoracoacromial artery, lateral thoracic artery, subscapular artery, circumflex scapular artery. Then now the last one. This is the anterior and posterior circumflex humeral artery. So these two are the anterior and posterior circumflex humeral arteries are the last two branches of the axillary artery. Anterior circumflex humeral artery runs from the upper part of the axillary artery, run deeper to the coracobrachialis muscle, winds around the surgical neck of the humerus, and anastomosis with the posterior circumflex humeral artery. The posterior circumflex humeral artery escaped from the axilla along with the axillary nerve through the quadrangular space. Through the quadrangular space, axillary nerve and the posterior circumflex humeral artery passes. Then it winds around the surgical neck of the humerus to anastomosis with the anterior circumflex humeral artery. Okay, anterior circumflex humeral artery give an ascending branch, whereas the posterior circumflex humeral artery give a descending branch. Axillary vein. Axillary vein is nothing, how it is formed, how it is drained, we'll see now. Yeah. Axillary vein is a deep vein which accompanies the artery. So it is formed by the median cubital vein. Who is median cubital vein? Can you just look into the dorsum of your hand? Can you see some bluish lines over there? These bluish lines are the dorsal vein, the bluish arch in fact. Don't expect a picture perfect arch over there, but something like a bunch of veins making something like an arch over there. That arch is called dorsal venous arch. The dorsal venous arch receives three veins into it, three tributaries, which drains the venous drainage from the dorsum of your fingers and major part of the venous blood from the palmar aspect of your hand. Okay, now the medial end of the dorsal venous arch run upward as basilic vein when it joined with a small vein draining the ulnar side of your little finger. It joined with the dorsal venous, medial end of the dorsal venous arch to form the basilic vein. The basilic vein runs upwards in the superficial fascia of the forearm, and reaches the superficial fascia of the arm where it lies medial to the biceps. In the middle of the arm, it pierces the superficial fascia and pierces the deep fascia. In the middle of the arm, it pierces the deep fascia to become deeper. Till the middle of the arm, it was lying in the superficial fascia. In the middle of the arm, it pierces the deep fascia to become deeper. Okay, this vein at the lower border of the teres major continues as the axillary vein. To this vein, the venae committens of the brachial artery openings. What do you mean by venae committens? They are a pair of veins which lies on either side of an artery is called as venae committens. Venae committens of the brachial artery opens into the axillary brachial basilic vein, opens into the basilic vein, and the basilic vein continues as the axillary vein at the lower border of the teres major till the outer border of the first rib, where it continues as the subclavian vein. Subclavian vein joined with the internal jugular vein to form the brachiocephalic vein. Okay, the right and left brachiocephalic vein unite with each other to form the superior vena cava, which opens into the right atrium of your heart. That's all about the axillary vein. Okay, if you got any doubt, please feel free to ask doubts. Please go through it. Thank you so much.